What will be the difference between Whiteness Perfect and the White Class product from FGM?
Okay, Whiteness Perfect is made of carbamide peroxide, which you have 16%. White Class will be only hydrogen peroxide, and we have other concentrations. We have 4, 6, and will be enough for us. If you use carbamide peroxide, you use it at night. You can use at least for 4 hours. If you use White Class with hydrogen peroxide, you use for half an hour or 1 hour, depending on the technique that you're using. So basically the difference is sleeping with it or using it during the day. But we might advise that hydrogen peroxide is quite stronger. So the possibility that you have on side effects is higher, which we have to select the patient that we use this technique. But both of them, if you have the right patient, will work well for you.
Okay. And another question. After how long can you do a retouch on the bleaching in a healthy patient?
Using the right technique and good products, most of the time you won't need a retouch.
For many years.
For many years. But if you have a case that you need to do it after 1 year, I think at least. Don't you think, Rodrigo?
Yeah, after 1 year. But again, what we see on the patients that have good oral hygiene and return every 6 months for a prophylaxis, we see that whitening treatment lasts longer. So it's a matter of how long do you. What I sell to the patients is like an extended warranty on the bleaching. That if he comes by for his prophylaxis, his bleaching will last longer, won't need retouch. And I think that a retouch is more expensive than a regular dental prophylaxis.
Yeah, let me tell you something about retouch. The best thing is that your patient won't do other bleaching. You know why? Because if you have a patient that he did the bleaching once and you keep maintaining this patient, he will be with you for a longer time. He will, the customer lifetime value for you will be higher, and he will be always happy with the job that you did on bleaching his teeth.
Just with prophylaxis and good oral hygiene.
Yeah, maintenance. That would be perfect.
Yeah. Okay, 2 more questions, so we'll wrap it up after 2 more questions. Can you do tooth whitening on a tooth with dental fluorosis?
Yes, you can. It depending on how is the fluorosis on this enamel. But most of the time, if we need to just do a restoration or a composite restoration, not a veneer, but only part of this tooth, yes, we can bleach. Most of the time we'll bleach only with carbamide peroxide, low concentration, because we have a damaged tooth. So we get a little bit clear and then we could make the restoration. But in some cases when the fluorosis will be quite higher or quite more severe, I think it's not good to do it. But in simple cases, yes, you can use it.
Until the mild cases, usually you might associate with a little microabrasion or any restorative procedure to get the result that you want, but should not be an issue. And very last question for our talk today is, when do you know that your bleaching treatment is done, that you reach the target or the point of saturation? how to communicate that to the patient.
Yeah.
Because the patient might have unreal expectations.
Well, it's easy when the patient says, well, I think it's it that I wanted, so it's perfect for me. But most of the time, you know that it's not that what happens. So what we gotta think, and what we gotta feel, and what we gotta check. If you're bleaching with a low concentration, and for 2-3 days it's not getting any change, you gotta think it up that, you know, might be time to stop. So you will change the concentration. You go a little bit higher and do some job on it. If you have more bleaching, perfect, you can extend some more days. But if you do not have this better result with this higher concentration in 2 or 3 days, you can call it up and say, you know, it's finished and I think it's time to finish this job. Because if you continue doing, even if you are not getting any bleaching, you might get some sensitivity problems. So that's why we have to check all the time, and that's why bleaching is so important, that the patient come back to the office at least once in a week for us to check how is the treatment going.
Yeah, it's just a matter of monitoring and advise the patient there are the classical average times, like for an office 3 to 4 sessions, and for the tray in-house bleaching we do what 3 to 4 weeks. Anything beyond that is attempt. But and usually once the patient pays the fee for the treatment, he wants more and more and more. If you do, well, this fee is for the average times that are used in the literature. Anything extra, you have to pay extra. Usually they tend to get happy. I say to use usually the white of the eye, the white of the tooth, they have to be close, you're in harmony. But some people want to get teeth that are lighter than their eye, then that won't be harmonious, that will be too artificial. So then try to show that to them and just reason with that.
Yeah, the balance is very important. Balance on how is your whitening going.
So we hope that you had a good time like we did, and we hope that we brought to you some valid information for our daily practices, and we're all available through any channel on social medias, Facebook, Rodrigo Reis,
Marcelo Alves,
and through FGM. You may send any questions to FGM, and us or any other professor that collaborates with FGM will be happy to address them.
We'll be pleased to help you out. Regards to all.
Thank you.